Good afternoon. My name is Rob, and today I'll be discussing clinical treatment for spinal stenosis. Spinal stenosis is a condition affecting up to 500,000 people in the United States, especially those who are expressing symptoms, have reoccurring problems with this condition. And it represents 1 per 1,000 persons older than 65 years old, and about 5 of every 1,000 persons older than 50 years old. So it is more common in older populations, although it is reoccurring, especially as the demands of activities of everyday living in the general populations becomes continuously tougher to carry out. Spinal stenosis is a condition in which the foramen, the inner column of the spine, decreases in diameter, and then this narrowing causes inflammation because the nerve that goes through it becomes inflamed and rubs against the wall, similar to this diagram I have here. And then, of course, inflamed nerve is going to cause uncomfortable sensation, pain, lack of neural responses with the lower extremities and those muscles that it's innervating. Common symptoms are, like I said, numbness, tingling, even loss of function, mobility in the spine, as well as the muscles that are being innervated by the respective nerves. So why physical therapy in response to treatment, plan of care? Of course, we have medications, but in the state rather like West Virginia, addiction rates are pretty high. And of course, the overall objective of a lot of physical therapy practices is to reduce the reliance on medication and manually improve your issues, which is very doable. The patient would be referred to a physical therapist, and this therapist would attempt to isolate and localize the pain as the first phase, generally to the lumbar region, the one isolated area. And then once the pain has been isolated, then you can start to improve mobility, stability, flexibility, strength, balance, endurance to the means of stretching, modalities such as heat and ice, resistance training, whatever you're able to carry out. Of course, there's contraindications with heavy loads of weight. The ones moving around that. Education is a key element of physical therapy, as you're, in a sense, providing knowledge on how to successfully carry out your activities of daily living without exacerbating the pain, maintaining proper posture and such. And of course, the physical therapist might actually involve manual therapy techniques. All right, and then we have the primary tips for prevention and pain management. Just some key points of therapy and just overall rehabilitation for this condition. One should always strive to maintain proper mechanics and everyday functional movement, keeping neutral curvature in their back, which is essential for the integrity of one's back and the pelvic girdle, and maintaining a proper core of strength and reducing injuries. In many cases, you're going to want to avoid the end range of motion and extension of the lumbar and cervical spines. There's going to be general precautionary measure, considering the client will find alleviation through flexion most likely. This ties in with the development of strength in both the anterior and posterior postural muscle chains, such as the paraspinals, abdominals, obliques, etc. And finally, we want to maintain posture, which is also considered abdominal bracing. It can be performed through PPT, posterior pelvic tilt on a table. It can be engaged in all exercise in every aspect of one's day. This will ensure the smallest chances of developing disorders as you maintain integrity within your spine, whether you're sleeping, walking, standing, exercising, to prevent issues further down the road. And that's what I have here for you. I also have a diagram that shows somewhat of a visual representation of spinal stenosis. And I have a few common exercises you're going to see once moving into a physical therapy clinic, generally outpatient. Some exercises you might be suggested. Of course, don't carry these out without the guidance of a therapist, but we do have the seated trunk flexion, the PPT, which is the posterior pelvic tilts from supine position. Then we're going to be doing a lot of exercises involving hip flexion to strengthen the core, whether you're in the supine position as well. Then you can do the upper part of the abdominals and obliques, which would be a sit-up. And then you have a modified double kneaded chest, which may provide just as much relief as single kneaded chest, both of which are very effective in spinal stenosis recovery. And overall, hopefully I was able to enlighten you and provide you with some insight on this condition of spinal stenosis. Thank you.